Welcome back. My name is Courtney Koenig with Empire Surgical, and tonight I'm here to discuss labral repairs. More specifically, I'm going to talk about a bank heart lesion using a Gryphon anchor from DePuy MyTech. I'm going to break it down into two major categories. One are the key features and ancillary options available with the Gryphon anchor, and two are the procedural steps one must take when inserting a Gryphon anchor. Let's talk about the key features and ancillary options of the Gryphon anchor itself. Four major features I want to discuss tonight. First is the size. The Gryphon anchor is going to be 3.0 millimeters in diameter, as well as 10.8 millimeters in length. Second is the cannulated anchor itself. Allowing blood flow inside the area of repair is going to increase the overall healing of the damaged labrum. Third thing is the revolutionary suture bridge, allowing for maximum slidability and manipulation when the anchor is inserted. And the fourth thing I want to talk about is something called a compression fit anchor. The Gryphon anchor is a compression fit anchor because it is slightly larger than the hole we're going to be sticking it into on the glenoid fossa, providing superior strength to the region. Let's move on to ancillary options of the Gryphon anchor. First thing we have is the composition or the makeup of the anchor itself. It comes in two different versions: PEEK or plastic, or polyethyl ethyl ketone. We also have BR, Labralrepair.MPG, which is a biocomposite absorbable anchor. We also have the amount of sutures differ on the anchor itself. It's going to become single loaded or double loaded depending on surgeon preference, both with orthocord. Third thing is the type of insertion on the anchor. We have push-in, which is going to allow the surgeon the ease of insertion. We also have thread-in, which is going to give the surgeon a more confident, secure, tactical insertion. Let's move on to the procedural steps needed when using the Gryphon anchor. First off, we want to make sure we have the shoulder tray, which is going to have the Gryphon drill bit, which is going to be 2.4 millimeters by 18.6 millimeters in length. We also need the Gryphon guide, which is going to come in either fish mouth or sawtooth. Sawtooth will add that extra stability in those hard to reach areas of the glenoid fossa. We also are going to need a spinal needle and an ideal suture passer. And of course the anchor itself. Let's start off with the steps needed. I'm going to skip the assessment and general diagnostic of the shoulder joint and skip over to the portal placements needed for a labral repair. We're going to have three major portals. We're going to have our posterior portal, which is going to be 2 centimeters inferior and medial to the acromion. We're also going to have an anterior superior portal, also known as a utility portal. I'm going to have an anterior inferior portal, which is going to be used as a working portal. Now that the portals have been established, we have the scope in the viewing portal or the posterior portal. We're going to go through the working portal and use a liberator. The liberator is also found on the shoulder tray and will be used to separate or release the labrum from the damaged area. We want to make sure we get it off completely off the glenoid fossa and are able to manipulate it so we can bring it back to its natural anatomical position. After it's liberated, we want to move on to step 3, which is going to be using the rasp. The rasp is a cheese grater type device used manually to create a bloody bed on the face of the glenoid. This will promote healing as well as give us an insertion point, which is step number 4. We're going to use a spinal needle to percutaneously go through the shoulder and point out the area on the glenoid fossa that will provide an optimal angle and insertion point for the anchor itself. After we decide what area we want to drop the anchor, we're going to insert the Gryphon guide with the obturator through it, insert it percutaneously to match up with our bloody bed. Once we get a secure grip on the glenoid fossa with the guide, we're going to remove the obturator and we're going to insert the Gryphon drill. You will drill into the glenoid fossa. Make sure you are superior to the damaged area because we always want to work up and in to provide a natural, anatomically correct bumper for the joint. We're going to bottom out on the Gryphon drill, which is going to give us a 18.6 millimeter hole in length, which will give us some leeway with malleting and suture manipulation. It will also provide us with a 2.4 millimeter in diameter hole that will help us with the compression fit anchor aspect of the Gryphon anchor. Now that we have the hole drawn, we are going to remove the drill bit and insert the anchor. We're going to leave the drill guide in there to provide the correct angle and ease of, or access to the drilled hole. We're going to either push in with the Gryphon P, or we're going to insert the tip and slightly push in and thread or drive the anchor into the face of the glenoid fossa. Now that the anchor is in place, once again superior to the damaged area so we can work up and in, we're going to have to start manipulating the sutures. Enter through the utility portal with a crab claw and proceed to pass the sutures from the percutaneous hole out the utility portal. Once all the sutures are in the utility portal, now we can pass the suture through the tissue of the labrum, which will create our post suture. This is very important to make sure we distinguish the difference between the post suture and the sliding part of the suture, because we want to make sure the post suture is on the back side of the labrum as well as through the tissue. We're going to pass one of the sutures out the working portal. We're going to load it on an ideal grasper. We're going to feed it through the kite of the chia, reinsert through the working portal, and using an angled ideal suture passer, we're going to pierce or pass through the labral tissue to create the post part of the suture. We will pull that through the utility portal, and we will also now pull the other part of the suture back into the joint and back out of the working portal. From here, we're going to tie the knot. You will tie a sliding knot over or around the post suture. You will load the post aspect of the suture onto a knot pusher and proceed to push down through the working portal onto the tissue and anchor itself. From here, we want to increase tension of the knot down onto the glenoid fossa and anchor and tissue. This will increase the tension to the repaired site. From here, we're going to go pass point, which will increase the tension on the knot. We will repeat this process 4 to 5 times to make sure the knot is in place and stable. From here, we're going to take a knot cutter down the working portal and proceed to cut the knot of the excess suture. Now we are left with a simple stitch sliding knot on the post part of the labrum, holding it down in the proper anatomical bumper position. From here, we're going to sew up the portals or repeat if necessary. Depending on the tear, you may drop another anchor, or depending on the anchor, we may have another suture to repeat that whole process. So, thank you for your time, and you have a wonderful evening. This has been Courtney with a Labral Repair. Thank you.